welcome. This is our final summer series for the year. What do you need to know? CEs will be sent out probably starting next week, and what we'll do is we'll just go through and you'll have one CE for all of that you have attended. If you're a licensed clinician, if you don't know what I'm talking about, that's totally okay. If you're welcome to be here, it's free and awesome to attend and learn. So, and then if you have any feedback about maybe you've got 3 hours is great, 3 hours is terrible for a CE, you're welcome to email me, Lauren_Barnes@BYU.edu, and just let me know what you thought from your perspective as a professional. I'm going to cater it to the students, but if I can adjust it, like in past years, we did it for like 1 hour, people didn't love that, so we made it 3. So if we can adjust to kind of help the professionals and the students, we'll do that. Feel free to send me feedback. So today we are lucky we have Adam Jones and Rebecca Lucero Jones. And Adam Jones is a doctoral candidate in the MFT program at Texas Tech. He is currently working as a student research assistant to Doug Smith. Adam has published and presented many times on the topic of couple sexuality. He completed his master's thesis on the role of sexual communication in couple relationships, for which he later received the AAMFT Master's Thesis Award. In his private practice, he's passionate about helping couples improve their sexual relationships. Rebecca Lucero Jones is a doctoral candidate in the Marriage and Family Therapy program at Texas Tech as well. As a graduate part-time instructor, she taught the undergraduate course, Family Dynamics of Addiction. Rebecca has been in private practice since 2012 and specializes in treating individuals and families in the areas of addiction and recovery, sexual trauma, childhood sexual abuse, grief, anxiety, depression, and couple and family distress. Rebecca has conducted several state and national workshops on the topics of trauma, addiction, and sexual relationships in couples. Go ahead and turn it over to them.
All right, well, she kind of already introduced us, but I'm Rebecca Lucero Jones. This is my husband, Adam Jones. And today we want to talk to you a little bit about couples and sexual communication, and we're going to define that and kind of help you know what we're talking about with that. And to kind of get us started off, we wanted to start with a video. And this should work, right? This is from Everybody Loves Raymond, if you're familiar with that. Oh, actually. So we like this clip. It's a good demonstration of maybe sometimes what can happen with couples. One person's in the mood, the other person is not getting the signals, not receiving the message. And so it's just kind of a funny way to kind of introduce the topic of how difficult it can be for couples to actually communicate sex and be on the same page. So we want to get to know y'all so we can kind of understand where our audience is coming from.
We're from Texas,
so
we say
yeah,
y'all.
I do say y'all. I'm not originally from Texas, but I've been there long enough. So
it's weird. Everybody said that you would start saying it as soon as I moved down there, and I was like, that will never happen. And then,
yes.
Sure enough, like a couple months in, you're like, did I just say that? And
yes.
So it could happen to you too if you moved to Texas. Anyway.
Okay, so I'm curious about where you all are practicing therapy. So who's all in a private practice setting? Okay, so we've got several people in private practice. What about an agency setting? Or maybe or anybody here in the school clinic? Okay, we've got some students. Any other places that you're practicing that I did not mention? Okay. So anybody here is certified sex therapist? Okay, so nobody quite maybe specializes in that way. We presented on sexual communication and sex therapy several times, so a lot of times we get a certified sex therapist. Okay, so how many of you have taken a sex therapy course? Okay, so a few of you. So some of you, this is new, would you say? Some of it's new? Okay, great. And so what are some of your hopes and expectations for this session? I know we have some different levels of experience in this area, but maybe there's quite a few of you who are maybe new. What were you hoping to kind of get out of this, hoping to learn about? Maybe that's hard for you to identify. Even for more experienced clinicians. Yeah?
I'm excited I first of all love that you're a husband-wife team.
Okay.
I think that's a little bit tricky to talk about sex as husband and wife together, so I'm excited to see how that dynamic works.
Don't make us nervous at all.
I didn't realize it was tricky until now, but
well, we're not going to talk about
I'm
ourselves.
really self-conscious.
No, I love male, female perspective
Mhm.
at the same time. I think this is going to be fun.
Okay, great. Others, anything else you're hoping to get out?
I'm just looking for a crash course in introduction to the fall semester. We're going to be talking about sex therapy.
Okay, yeah. Okay, get a little bit of foundation. Okay. Any others? For those of you, okay. So for you who have been seeing couples already, and maybe they've come in with sexual issues, or maybe they haven't presented sexual issues, what are some of the challenges that you face when treating couples who present with sexual issues or sexual communication issues?
Where one of the main points of conflict is a difference in desire.
Okay.
One person in the couple doesn't see it as a problem and one person very much does.
Okay. Yeah, that's a huge problem. Yes.
Or like how underlying insecurities or past relationships kind of play into that sex dynamic, and how to kind of like navigate that.
Okay. Yeah. Yeah, the past definitely affects the present, and how do they tease that out? Okay. Other challenges with working with this type of issue?
I
Yeah.
think it's interesting how in relationships, one person will often complain about what's happening in the relationship sexually, and yet when you really get down to it, they're the one that's most insecure. I think it's fascinating that when you're seeking,
Mm-hmm.
pursuing, and yet in all that pursuit, there's often a lot of insecurities.
Yeah, that's a great point, that sometimes they're pointing the problem at somebody else, but the problem's right here.
Displacing it
Yeah.
totally.
Yeah, and that doesn't happen just in sex, with sex, right? That happens a lot with couples, but that's great because it can be very distracting for the therapist if you get too caught in the content of what they're saying and you're not aware of the dynamics that are going on in the couple that perpetuate these problems. It can be really problematic if you continue to focus where the couple focus is and you're not able to kind of see what the couple can't see. So that's a great point. Okay, thank you. Okay, so
So we wanted to talk about sexual communication in couples specifically, because I know this is a comic, but I've seen similar sorts of things happen in couples in treatment. They come in and after marriage, oh yeah, we never really talked about this beforehand, and suddenly we have a large disagreement on what should happen and how we should go about it. So this idea of sexual communication really became of interest to me. I did my master's degree at Utah State, and early on in my master's training up there, there was a couple that I watched. I was just behind the glass. I'm sure people are familiar with that, like sitting behind the glass, watching sessions, getting familiar. And there was this couple that they'd been married like 35 years. They had been together a long time, and I watched as the wife in the relationship told the husband that she had never had an orgasm, and the husband was just devastated, right? So they'd been together a long time, they'd been having sex a long time, but she'd never been able to communicate to him that sex wasn't satisfying for her, that she had an orgasm, or there was a huge misunderstanding. And I thought that was so interesting. I was like, how do you go that long and not talk about that? And it kept coming up and coming up. For those that are practicing in Utah, since I've moved to Texas, like the amount of clients that I've had that have presented with sexual complaints or issues related to sexuality has gone way down. When I was in Utah, like a large percentage, I see a lot of people shaking heads, so this probably isn't unique to me. A large percentage came in with whether it was pornography and one partner was hurt and they're trying to navigate through that, or there were other sexual issues. That came up a lot, and so I kept noticing it. So that's why I eventually decided to do my master's thesis, do some research on it. So I wanted to look at how do people communicate about sex specifically within their relationships, and unfortunately, I wasn't the first one to think about this. There have been people studying sexual communication for a while. But really this whole field of research is kind of developed looking at sexual communication distinct from just other areas of communication relationships. And what people have found that there are a lot of couples who may communicate about certain areas of their relationship really well, but really struggle when it comes to sex, right? So a lot of these researchers are trying to understand why that is, what's happening, and how we can help people communicate about their sexual life. There's a lot of reasons for that, right? Oftentimes in really conservative areas, or no matter what your growing up is, a lot of times people don't have open conversations about sex with their parents. It's really taboo. Who are you getting the education from? I mean, these are all things that we're pretty familiar with. But sex often just isn't discussed. Sometimes you don't have a model for how to discuss sex in a relationship. And so it can be difficult to navigate at any point in a relationship. And that was one thing, when I was early on, I really wanted to just look at people transitioning into sexual relationships. But as I've looked at the literature, it shows that couples struggle with sexual communication at all points. Older couples do too, and I mean, it's something that continually has to be negotiated. So as we go through this workshop, we're going to be talking specifically about how couples talk about sex, how that impacts their relationships, and what that means for treatment. How do we help these couples talk about sex in a more efficient way, and in order to promote satisfying and healthy sexual behavior. So I forgot the clicker, so let me skip to the next one. So as far as our goals, I kind of just went over this, but we want to talk about the barriers that people have when it comes to talking about sex. Understand how to assess. One, for sexual functioning. We will mix a little bit of sex therapy class in there. So, but how to really clearly assess for what's going on sexually within a couple, and also how to assess for the communication. We'll talk about some of the research that we've done on sexual communication, and that we're currently engaged in as well. And we'll also do some activities at the end to talk about how we can how you can work with couples and foster that. So yes. So
I guess sorry, we never did. This is new. Okay, so we are gonna play a game.
yeah, we want to get people talking a little
Did you
bit.
get it?
Oh, it wasn't yet. Oh, is it not? Oh man, technological issues. Well, just imagine the Family Feud theme song is playing. And you're getting all sorts of excited, and there's lots of energy, and then you can just picture me as Steve Harvey, which I'm sure is everybody's dream. So let's. So we're gonna do a little bit of a. There it goes. Here it goes.
I don't know what happened.
So I think if we're going to talk about sexual communication, I think we should start talking about. Oh yes, you are holding that. Okay, so I just felt like if I'm the game show host, I should have something in my hands.
Yeah, we want to take all the things.
That's okay. So we want to play a little game. We're going to just split the room in two, if that's okay. Let's.
Yeah, well, no reason here, so we can just.
Yeah.
I may not be super
So you may have watched Family Feud before, and we're just going to pretend that this side of the room, that you're just a family and that you know each other really well, and this side as well. So what this is actually based off a recent research study. The citations there at the bottom. It was one of the largest national studies on sexual fantasies and sexual behaviors and sexual experiences. And they did a survey to see what the most satisfied, sexually satisfied couples do, what sexual behaviors they engage in. So we'll just talk about this a little bit, and we'll just see what people think, see what satisfied couples do. So So,
Yeah, so let's just have it be that in your group, you can kind of talk about it, and then when you guys come up with an answer for what you think, right, is one of the top 10 things, activities that couples are doing, right, that are sexually satisfied, raise your hand.
Behaviors.
Behaviors,
Yes.
yeah.
Yeah,
Most
sexual
of them are
behaviors.
behaviors, things that the couple do. So they can just be couple behaviors or specifically sexual behaviors.
I'm kidding.
Yeah, I mean, maybe. I'm not. I don't want to give the
Yeah, no
answers away.
spoilers.
So when you're ready, raise your hand, and then we'll go to whichever group has the answer. Yes.
Alright.
What was that?
Role play.
Role play.
Role play. Survey says. I was really excited to say that.
Okay, that's not specifically on
Role
this.
play's
on
not
the
in there.
survey.
Okay.
The answers might be a little more broad than that. Maybe.
I guess we're starting with this
Broader than
side.
that.
We'll go.
Okay, so
we'll go
it's-
Family Feud
okay,
side.
yeah.
So that's 1X. I
Okay.
watched the show.
Oh.
Okay. All right.
Okay, so.
Share fantasies.
Okay, yeah.
Survey
Yep.
says.
Survey says.
All right.
Ding, ding, ding.
Still on this side. This
That's
side's
number 10.
this side's on the
Number
board.
10. So, okay, and so I have some numbers on here just to help you guys know. So they actually broke it down by males and females because the answers were a little bit different. So in satisfied couples, 40% of males reported that they talked about or acted out our fantasies. And then 37% of females said that they talked about or acted out their fantasies. Okay. Okay, you guys can keep going since you got one. Okay, who's next in the group?
Should I just say things or do you want to?
Yes.
I would say cuddling.
Cuddling.
Please don't be it.
I don't see
No,
cuddling.
no, cuddling was not reported. Okay, that's another X, right?
Oh, no.
Was that an X? No, that's one X for them, right? What is this? No, is that
That's
another X, okay. Team one. Okay,
So do you have one more?
okay, I think you have one more chance.
You got one more. You got
Yeah,
one more. X.
Oh, work with them.
Oral sex?
Very engaged in oral sex.
It's oral sex on here.
Okay, I'm gonna
No, it's not. It was
Okay,
on the
it's-
larger list, but
It's not
it's not in the top 10.
It's the top 10.
Okay.
Sorry.
It might be like number 11 or something.
Yeah.
All right. Well, this has proved to be harder than we thought. All right. We'll pass to this side.
Okay, this side.
They hang out together.
They
Spend
hang out
time.
together. I'll take it. I say number 4.
Oh, okay, number 4 is fine. Yeah,
We went straight to the Genesis.
it's pretty close.
They made a date night
They
to be
made
sure
a
they
date
had
night to be
sex.
sure they had sex.
I was like,
So, interestingly, you have 63% of men saying that, 55% of females. So, it's interesting, right? They're making time, specific time to have sex.
They have foreplay.
Foreplay.
Oh, that one was already guessed by them.
Oh, it was?
Yeah.
No, it wasn't.
I thought that was like.
Maybe like more specific foreplay.
Yeah, you're really
Making out?
Making out.
No, that
It's
was
not on there.
No, that's not on there.
Sorry. I got an X. I got it over here. I got
Oh, no,
They have children?
Yeah.
They have the big factor.
Yeah, yeah.
Access to babies.
Okay. Okay.
What's the sample like? Are they?
This is a very large sample.
So
Okay.
they're people who are parents.
So, yeah, there,
Yes,
it's a variety of people. It was
This
people
is
that
so
have
actually.
people, right?
So I looked it up a little bit ago. They, I mean, it was a national survey. They published it through several like news sources. So that's something that always happens when in sex research. That's one big limitation is you get people who want to fill out a survey about their sex life and want to tell people about it. So, so you know how normal it is or how not normal it is could be debated, right?
Okay,
Yes.
yeah, this team needs to decide.
Experience orgasm?
Okay, no.
No.
That wasn't.
I don't like
Yeah.
study.
These are,
Well, these are
all
more
things-
behaviors that they, like the things they did rather than the outcomes.
So these are more relationships general than sex specific?
No, they are more sex.
It was people that were in committed relationships beyond 3 years. Committed sexual relationships beyond 3 years.
they have another X, and then you have one
In
more
terms
X.
of like, the foreplay, I think there are a lot of things related to foreplay, like things
There
that
are.
people did
Think
to
about what
get in the
couples do
mood,
to get in the mood.
excited.
Gave a sexual massage.
Yes.
Yes, we're getting
Survey
closer.
says.
Number one. Taking massage or back rub. It was very surprising, right?
How is that?
Okay.
I know, I'm working on this.
Okay, you guys can keep going.
That's why I'm here.
Okay,
On this side, you guys
we're
got
getting,
one more
we're getting
X.
in the right area.
Okay, what compliments, like giving and receiving compliments, or like,
Nope. It's
Nope.
not on the list.
Okay, back to you all.
Steve's a little bit.
You guys are way too vanilla.
Is that our turn now?
Yeah, we'll go back to the other side. Yeah, that's.
Yeah, it's your side.
I think we should go to, well, she was
We
talking
just
about
did.
setting the use lubrication candles.
I'm going for open communication.
Oh, I feel like they already said
You know, that's
Did
not.
they already say that?
What about sending text messages? Sexting.
Oh, sexting.
that's good, but that's not.
Also not.
I didn't think this was to be this hard.
Yeah, we should have thought more about this
Do we
list
take a
before we
chance?
did this activity.
Yeah, we'll do the 3 chances again. Yeah.
Like,
Yeah, let's do one more round of 3 chances, and then, like in Family Feud, if nobody gets it, we'll just
can I
repeat.
do one? Flirty? Has anybody said flirty?
No.
Flirty.
It's more specific than that.
More like
okay?
sexually
It's actually
specific.
like it's
Long kisses. Like that?
Well, somebody said no. Trust me
We're
when
gonna
you
count
see
it,
these,
make
you're
it
gonna know
count.
what they are.
Experiment with different positions.
Oh,
Try the new position.
Okay.
Wear lingerie.
59
Are you
and 3.
listening?
Yes. Yes. Now we're getting there.
Number 2.
Lingerie.
Candles and.
Candles are not.
Stop lighting.
Candles. Did you guys have one more?
No candles.
What about new locations, like?
Ah, that's good. Number 6.
You think? Yeah, we'll count that.
We'll count it.
We'll count it. A romantic getaway.
Getaway.
Okay.
I guess not all the locations.
How many is this?
Okay.
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 Yeah.
Sorry, what was that? Yes. Yes, that was actually on there.
Yeah,
Born together.
9.
That was another thing that people did. Okay. Okay. Enough. You guys keep going.
I'm really sorry.
It's okay.
3 more.
I think
We're on a roll.
here somewhere, but definitely crying around. They were clean, like they didn't have showers and showers together.
Yes. Yes. So come out their shower together.
Oh.
What about, I don't want to say anything, if you guys have one.
They brought food to bed.
No.
Food to bed.
Okay. Yours now.
Oh, that's 3 X's. All right, we got any more on this side?
Is sex toys on there?
Sex toys.
It is on there.
Nice.
They use a vibrator or a sex toy together. Okay.
Go
There's
one.
one more.
Yeah.
Like dirty talk.
No.
Dirty talk is not on there.
No.
Oh, that's good.
I think to me this would have been the hardest one to get.
Yeah, that's probably was.
Don't show us what.
Okay, we can just show you. Is that okay?
Yeah.
Yeah.
Yeah, we good? We good. Okay.
Okay.
It
It
was
was try anal
anal
stimulation.
stimulation.
So it's not anal sex, but it's some kind of. It wasn't. I actually don't know specifically what that was. But anal stimulation. So being somehow stimulating the anal region. So anyway, this is interesting, right? Because when we were reading through the study, I thought that a back rub wouldn't have been the thing that I thought most people would report, right? So it's interesting to think about the different things that happy couples are doing. Well, I should say satisfied couples. I don't know if I didn't say they're happy or satisfied. right? That they're wearing lingerie, taking a bath or a shower together. And so some of these things, right, like I told you that, like the anal stimulation, that would probably be something I wouldn't have guessed. Right, this is something I probably would have guessed that would have been higher. And so I think it's kind of good to look at studies and realize that maybe sometimes the way that we see the world and we see sexual relationships may not be the same way that other people see them, not meaning that every couple, right, has it in this order or even does all these things, right, because the highest one we have is 72%, right, so not all satisfied couples are doing these behaviors. But it is important to see that there's a variety of things that people are doing, and that you may ask certain very specific questions, and they may be engaging in other behaviors that you haven't asked about or that you haven't assessed for, and so those are things to think about.
No, that was awesome.
Okay, so there's this little cartoon I like. We're going to talk a little bit about self as a therapist, because I think when talking about sexual issues, this is really key to being successful with couples. And I like this elephant because I think it represents our own selves and the problems and the past that we have. Is that right? It's right there in the room, and sometimes we don't acknowledge it, right? We pretend that we maybe never have sexual struggles, or we can think that well, I don't think we think we're perfect in our relationships, right? But just like any other couple, we're two individuals coming together, and there's always going to be some conflict. There's going to be need for communication to work through things, to get on the same page. And so being aware of how we are in the room when we're working with couples and sexual issues, I think is really important. So we're going to talk a little bit about therapist comfort. So what do we know so far? So there was a study that was done by Harrison Hayes. It was done in 2008, so about 10 years ago, where they looked at education, supervision, clinical experience, and knowledge to kind of look how those different aspects affected the therapist in the room. So they asked the question, does education and supervision with clinical experience influence perceived knowledge? Okay. And the answer is yes. Okay. So the more that you have supervision, the more clinical experience, education, the more confident you're going to feel, right, in your knowledge. Okay. So does education, supervision, experience, and knowledge influence comfort when working with couples and sexual relationship? Yes, but experience do not have a direct effect on comfort. So even if you've done this, it doesn't mean that just because you're conducting therapy with couples on sexual issues that you're magically going to be more comfortable. That doesn't necessarily always happen. And then education, supervision, experience, knowledge, and comfort influence sexuality discussions with clients. Yes, but knowledge does not have a direct effect on discussions. So what this means is we can be experienced, we can know a lot about sex, but that doesn't mean that we're comfortable or that we're actually assessing for these things. And that's a big problem, because if you aren't uncomfortable talking about sex, imagine a couple coming in who has sexual problems. They don't have friends they feel comfortable talking about. They can't talk to their families. They probably don't want to talk to their families about it. Maybe they've never had sexual discussions. And they may be coming in and expecting you to do that heavy lifting for them, to introduce those tough topics that they may not know how to bring up to their partner. They may not know that it's appropriate to talk about sex, because maybe their parents never talked to them about sex, and never talked to them about talking to their spouse about sex. So these are things to be thoughtful about, is that really the burden is on you to make sure that if couples need to address these issues, that you're providing a space for them to do that. Because otherwise it may not happen. And with almost all my couples, when they come in for therapy, I feel like, I would say 80% of the time, I have to bring up sex. And when I do, they always almost tell me that there's a problem. So they're coming in for other communication problems, and they say, well, what's your sex life like? And they like look at each other, right? And they're like, right? And then we dive into that. And there's some major problems. And sometimes the problems are easily resolved. Sometimes I've had elderly couples where they literally just needed to go see a doctor and get on estrogen pills. And then she came back, the next time and said, I'm a new woman. Like she literally said that. She's like, it was so much fun. I felt like we were 25 again, and so that's the thing, is a lot of people are having like uncomfortable or painful or bad sex, and they don't have to be, right? That sex can be a tool and a resource for couples if we're willing to have those discussions with them. So some common clinician difficulties that we just kind of want to talk about. So what prevents you from inquiring about sexual functioning and satisfaction? Yes.
I'm scared of spooking clients.
Okay. Yeah. Have you ever had that happen?
No, I'm too new.
Okay. Okay.
It's just an unfounded.
Okay, but there's a fear that what they'll.
That I'll offend them, that they'll be like, oh my gosh, that's too forward, and they won't come back.
Okay.
I had a client about a month ago, like walk out. I didn't actually introduce the topic, his wife did. But it was an intake session, and she said, oh, and there's this and this and this about her sex life, and he was like, okay. And he was like, right, so yeah, there can be. That is a real fear.
Yeah. What else? And I know some of you maybe haven't started seeing clients yet, but what do you think might, so if you haven't seen clients, what do you think might prevent you from being able to do that?
I'm like never quite sure if I should use like the slang terms or if I should use like scientific factual words, and I'm not quite sure like exactly what kind of language they'll be more comfortable with to introduce the topic.
Yeah. Yeah, that's a great point. I mean, we can talk about that. I think in general, I use just the standard terms of like sex, right? As opposed to any other term like intimate relations or something, right? I just use the most common term, but you may find that they'll start to use different language. And you can, I mean, a lot of times I try to mimic people's language, unless I feel like their language is maybe, right? If somebody couldn't say the word sex, I might ask them about that. Like, I noticed that you don't like to use the word sex. Tell me about that. Because that may also uncover some things that have gone on. You might be able to assess for the history of how sex was talked about in the home growing up. Okay, that's a great point. Is you could use terms and that could be offensive. So that's something to be aware of. What else?
Well, when I first started, I remember the one particular couple, this brought up like, oh, I'm LDS, but my mom, she to this day she doesn't like talking about sex. In fact, too much. So there's some memories there. But when I first started, I remember one couple kind of told me after we were talking about sex, because I was very comfortable with it, and that's kind of like, oh, I didn't think about that. And they were like, well, we feel kind of dirty talking about it, you know, in an LDS context. They were feeling like, oh, we feel kind of dirty. This is not appropriate for them. So that, I think that can be a concern when you're seeing here in this population, LDS couples, and they feel like they're dirty.
Yeah.
Talking about their sex life.
Yeah, that's a great point. And the elderly couple I told you that I was working with, they actually were currently LDS, but they were not raised LDS. But they had even talked about, even being in their 60s, how they were raised not to talk about it. So even sometimes in different homes who may not be LDS, right, we don't know the context of their family and whether or not it was okay to talk about it. And they also felt dirty talking about it. And so if you feel dirty talking about it, even though you may feel okay to engage in sex, if they feel dirty talking about it to you, they may not even be able to talk to it about each other, right? So that's a great point. And that's why I kind of said earlier, the burden can be on you, because these are things that are so hard for them to talk about. But when you can talk about them with ease, and you can be a very nurturing presence in there for them to really discuss these issues without feeling shame about wanting to discuss these things, all of a sudden you give them permission, right? You give them permission to grow this part of their relationship. And I think that is really key. Any other things that?
So like a lot of couples that come in with a lot of problem already, so their sexual life hasn't been satisfied, so when I ask, there could be offending
Okay. Yeah.
Or lack of confidence in your ability to help them with it. Like, sure, let's bring up your sex life, and great, now I don't know what to do with that. Now that
Like, whoa, that sounds bad.
yeah.
I hope you can figure that out. Yeah. That's true, yeah.
I think like being single, people have a hard time like feeling comfortable sometimes like opening up about their sex lives to someone who's single. I don't know. I've like seen that kind of play out a little bit.
Okay. Yeah, so sometimes maybe thinking about like the own factors of how they see you and the demographics that you fit in. Yeah. Like maybe you're a young person. Yeah, I've had male clients who may be middle-aged and, right, I'm like, I'm 34. I'm a 34-year-old young woman. And so, right, that can feel awkward to say I'm a 50-year-old man and I'm going to talk to this young woman about my sex life and I can't even talk to my wife about it. It can feel different. That's why it's better to always get both people in the room, right, to have the actual couple to work on it. But sometimes it can be feel very awkward, especially I think if it's the opposite gender. Sometimes they can feel, yeah, that can be problematic where they're like, is it okay, like, because I've never really talked to anybody about sex and I'm talking to someone about the opposite gender. And I mean, who knows, right? Like, I mean, even though like we're therapists, like we're all people, you don't know, even though your clients probably may not think anything really, they might find you attractive, right? Not that they want to act on it, but you don't know whether or not that is an issue, right? So those are things to think about, right? Your own demographics and yeah, I mean, what if you're single and you've never engaged in sex and there are couples coming to you with your sex problems? It makes sense that you might feel, right, a little inadequate to do that. But I think that's why you get training, right? That's why you go to classes, that's why you're here today, right? And one thing that I think is really important to realize as a therapist is you can never have personal experience with all of your clients' problems, okay? Nobody does. Somebody's gonna go in, they lost their mom yesterday, your mom is still alive, right? Your mom's never had an illness. So I think remind yourself of that whenever you feel insecure, is that there's no experience, there's no therapist out there that has had every experience. But you have been trained to think about problems, to track patterns, track communication in a way that these people cannot do for themselves. So even if they have more experience parenting or with sex, that doesn't mean that you can help them. Okay, so another important thing is identifying personal versus professional discomfort with the subject. Okay, so when I think of professional discomfort, I think about maybe I don't know enough about this topic, right? Maybe you get a gay or a lesbian couple and they're coming in and you're like, I don't know really much about working with the LGBTQ community. So that might be some professional discomfort, right? And meaning that I haven't received enough training to really feel comfortable with this, okay? But there also might be personal issues with that, right? Maybe you get a gay couple and you're like, well, I disagree with gay relationships, right? And how do I do that? If personally, I don't really support those relationships. Or there could be different practices that your clients are engaged, sexual practices that you don't agree with, right? So you have to think about what's personal and what's professional, okay? Because those are going to be two different ways to resolve those issues. If you're having professional difficulties, right, you can receive training, supervision, get more education, things like that. If it's personal, right, you also can seek supervision, but you need to be looking into how does that impact you in the room, how can you still be an effective therapist, even if you may not agree with everything your clients do. Or also with personal discomfort, what are some personal things that might make it difficult for you to sit with a couple when they're talking about sexual issues? Okay, I got a few minutes. Yeah.
I'm personally just comfortable with like S&M.
Okay.
So like if that's a standard of their, routine practice or whatever, because I'm always wondering like, is this symbolic of what else is happening in their relationship?
Yeah. Yeah, so sometimes certain things might set up red flags as where for them they're like, this is not a big deal, why would you even think that? Why, right? Okay?
I'm just gonna say, where people come in that are also, I'm LDS, and so an LDS couple comes in, and I interpret doctrine differently. I wanna just say like, no, your interpretation is wrong, this is what it really means, but that might be like a more personal problem that I'm having.
Yeah. Yeah, so that can be difficult when they know you're LDS. So I'm in Texas, so sometimes people specifically want to see me for therapy because I'm LDS, right? They like that I know where they're coming from in general, right? But yeah, what if a couple comes in and even though you may not think the LDS doctrine says it's only okay to have sex, to have a baby, somebody might come in and say, no, the Bible says it's for procreation. Yeah, and what is the scope of your practice, right? The scope of your practice is not to teach religion, right? You weren't trained, you're not licensed to do that. But yeah, that can be difficult, right? Especially if you feel like a misinterpretation of something is perpetuating problems. Yeah. Any other things that might be personal?
I think it's really great to know colleagues that are really experienced or trained in an area that maybe I'm not, but I feel perfectly comfortable referring. So, you know, these are some people that might be able to help you better with this situation.
Yes. And I will say, I think, yeah, depending on the issue, I think it's very important, one, that if you are not trained to work on it, that you have a referral. So I've had clients that are transgender or gay or lesbian, and it is disheartening when they say, I have called a lot of people and no one will work with me, and work with me based on religious beliefs, right? And ethically, that's not really ethical, because you need to be trained to work with all different kinds of populations. You can't discriminate. But also recognize that if somebody calls you and says, I need help with this problem, and you're like, I can't, you can be causing some damage to people by not having a referral. So if you don't, find out, help people find the help they need. Like, we're in a helping profession, because sometimes just looking for someone is exhausting and can be really disheartening, where no one will work with me, no one will help me, and I need help, right? I mean, that could be the same if they were looking for somebody to work with a child with autism. I mean, imagine that if you called 10 therapists and no one would work with you and nobody would refer to you. So be thoughtful about that. If you aren't comfortable and this isn't going to be your expertise, make sure that you find someone you can refer to. Okay. So assessment. So for those of you who are working with couples already and kind of deal in the realm of sexuality, what are some things that you ask, and how do you ask it?
My go-to for assessment is to do a sexual timeline, so kind of give them the parameters of when's the first time you ever heard something even remotely sexual, towards if your parents ever decided you don't have to talk, towards your first sexual encounter, etc. And so I just have them write out a timeline, and then we just go through it and discuss it.
Yeah, that's a great idea. That way they kind of start in this place that might be a little more comfortable, right? That was just from their individual past, and then they can work up to what's going on right now. Okay, other people. Yeah.
I mostly focus on sexual addiction couples, so I'm asking a lot about sexual safety, because the wives are betrayed, and to re-engage takes a lot of emotional safety and physical safety, and so that's what I'm focusing on.
Okay. Yeah, so asking about safety, that's important. Great. Others? Yeah.
If I have a couple that's coming in with just general communication problems or whatever, in my assessment, I'm kind of just going through and I'll just ask, how's your sex life? Are you satisfied with it? And then that kind of just opens, usually if you're comfortable with it and you're not tippy-toeing around it, then that creates a level of comfort for them too, and it's just a part of the conversation a lot of times.
Yeah, it can easily be part of the conversation.
Right.
Okay. Yeah.
Sometimes I'll have couples that I can tell are uncomfortable talking about it, and that do a little role play where they're teaching their children about sex, so I can sit back and observe how comfortable they are, just imagining teaching one of their children about sex, and that gives me a lot of information.
Yeah, that's great. Yeah, that there's different ways that you can kind of assess a role play. Yeah, is very helpful. Yeah, even directing your clients to have conversations with each other can be revealing. And sometimes that's the nice thing about therapy too, is sometimes when you ask questions directly to clients, they may be able to say something about their sex life that they weren't able to just kind of go to their partner on their own and say I'm really not happy about this, because they're really worried about hurting their partner, right? Maybe a lot of things are pretty okay in the relationship, and maybe they don't want to blow it up, like that couple that Adam talked about, where the woman had an orgasm for 35 years. Maybe she's happy in a lot of areas or things are going well. Yeah, at what point is it a good point after a couple years to say, by the way, I have an orgasm, right? 5 years, 10 years? I mean, any of those, he probably would have been shocked, right? 35 for sure. But sometimes it can be hard. Okay. How are we on time?
We're good.
We're good? Okay. So what are some biases that you think influence you and how you assess for sexual problems, or maybe even discuss sexual problems?
I have a lot of impatience for poor parenting. So when you have someone come in and they've come from a home that was so ultra conservative, I get real impatient with their parents. In my mind, it's
Okay.
like, oh, brother.
Mm-hmm.
You know, so that's a little something I have to work on sometimes.
Okay. Yeah.
I have kind of a similar thing. We get a lot of reports of sexual addiction, and my first thought is always probably not.
Oh.
Probably not addiction. It's
Yeah.
probably like you live with once every 3 or 4 months, or you know what I mean.
I
Yeah.
had a couple come in once where.
This is a great story.
The wife claimed that her husband had a sexual addiction, and the husband claimed that he had a sexual addiction. And so I started asking questions around that. I said, so tell me about your sexual addiction. He's like, well, it's porn. Like that's what I use. And I said, okay. I was like, so tell me about your porn use. How frequently do you view it? When was the last time? He said, well, I was like, well, at its worst, how often did you view it? He said, well, when it was at its worst, I viewed it about once a month. And I said, okay. I said, so when was the last time you viewed it? He's like, about 2 years ago. And I was like, anyway, I mean, he was convinced he had a sexual addiction, right? He was convinced. And there weren't any other sexual abnormalities that were really going on, or paraphilias or anything like that. It was, yeah. Right. So the definition of sex addiction can vary widely.
Yeah.
Yeah.
Yeah, and that can be a problem, right? Because it exacerbates it exacerbates the problem rather than, saying, well, why'd you look at that, or like letting it go. Sometimes you build the problem up and then it becomes more a problem, it becomes more compulsive to do it because there's all this anxiety around it, as opposed to like, he looked a picture 2 years ago and we can move on from that, right? Like, everybody makes mistakes, or everybody makes choices, and they can make different choices tomorrow. So, yeah.
I do a lot of EFT therapy, and so a lot of times the E doesn't stand for erotic, and so there's not as much of a focus in EFT with, the passion side of things.
Mm-hmm.
It's a very different way of being able to engage with the couple. And so sometimes my bias with EFT is I'm constantly doing that emotional processing and processing and processing.
Mm-hmm.
It's like, well, sometimes we need to just talk about passion.
Yeah.
Sometimes we need to have different conversations.
Yeah.
So I would challenge you, how is eroticism or arousal not an emotion? Like, how is that not exciting, or an experience that we can talk about with couples? I think even within EFT, that sexual realm. Oh, sorry. Can be very emotional.
I went to a really good workshop at AMFT, and it was about Christianity and sexuality. And for those of you who are familiar with Bowen and differentiation, it was really interesting. The speaker had like this spectrum, and he talked about how a lot of times we have like God on one side and sex on the other, and it can be that way. And I thought about like my own experience growing up, and it was like, no, even though I feel like my family was very open about sex, I knew that like sex was like totally off limits until marriage. And so there was all this development of like spiritual development as I was young, right, of growing closer to God. And then all of a sudden it was okay to have a sexual relationship. And often though, like, it's been a process to learn how to integrate those, right? That sex and God are not two separate things. And I've thought about that, how a lot of times people don't know how to, I guess maybe be erotic and feel like it is divine, right? That's a divine part of us. It feels like, yes, to make a baby, it's okay. But to really enjoy sex, right, maybe can feel like worldly, because the world and the media talks about sex more than the church does, right? Your parents don't talk about it. So all these places that you affiliate with goodness don't talk about sex. And then all these, these places where there's danger and there's all these different ideas, right? They're the ones who are talking about sex. And so realize that happens for couples and for individuals, that they really haven't learned that sex is something that's divine. And so helping them to see that it's not sex or God, that those things merge together, I think can be really important, especially for Christian or LDS clients.
For one of my LDS clients, as I'm doing sex therapy with them, I gave them the homework of like going to the temple with like 2 questions in mind. The first one, is God a sexual being? And second, what role does God want sex to
having your life. And they came back from it and had like a really good experience of like, it is okay to be a sexual being. God's a sexual being, and he's okay with me being a sexual being. Yes, within these parameters, but it's okay to be a sexual being.
Yeah. Yeah, that's great. Yeah. So asking your clients challenging questions, right? In a way that's respectful of their beliefs, right? Obviously, people don't want you to come in and tell them that what they believe is wrong, but I think you can ask thought-provoking questions that can help them to challenge the parts of their beliefs, right? Because there's probably like truth in to some degree in some of their beliefs, but help them to be critically thinking about maybe some of the assumptions and beliefs that they take into the bedroom. I think that's really important. Yes?
I just wanted to add how we language things can be potential blind spots for ourselves. The words that we're using versus the words that our clients are using. Even always referring to addiction or compulsion. You know, I tend to talk more about for addiction work as unwanted sexual behavior.
Mm-hmm.
I think it's more open for them to feel that there's not a label on them that
Yeah.
like the guy that you're talking about, he's not an addict.
Right.
And even how we talk about, well, that's just a part of yourself that is wanting to do something for you and is learning to cope with something. It's just a lot more free than giving people labels and just being aware of maybe some of the language that we're using when we talk about certain sexual functions, or use their terms and use more free and open terms as well.
Yeah, no, I appreciate that. I love that. And even like when working with couples, right, helping the spouse to realize that that's a part of them, right? Because sometimes, especially if there's some type of betrayal or like with the viewing of pornography, right, that might feel like a betrayal. Like I don't look at other people and you just looked at somebody online. So it can feel like a betrayal, but sometimes, right, that totally changes the way they view their spouse. So yesterday, my husband was the best husband around, and now all of a sudden, he's a pervert, right? So, but right, that's one thing he did, right, over the course of, so many months, right? That was one choice he made. And so I think that's great to kind of really help people put things in perspective, because I think especially when you feel like threatened, like in the relationship, people have the tendency, right, it's addiction, right, to be hypersensitive to that. So helping calm the couple, right, so they can feel more confident in their ability to work through things.
It's a double-edged sword too. I mean, you get a lot of people who have gone to like recovery programs or Sexaholics Anonymous or Sex Addicts Anonymous or like some of the LDS support groups that there are, and they really identify with that term of being an addict and having an addiction and being powerless over that addiction and having to give that, give that to God and recognize that they're helpless over that. So it can be challenging, right? There are couples where you're like, I don't know if that's really what you got, or so some people can be freed by that. Some people can be really intimidated by that language of saying this is an unwanted behavior or something like that, because they've been so ingrained in that recovery process that they might be really used to. So
this is something that I struggle with because I can't really figure out what the boundary is as far as when it's appropriate to challenge and when you work within the client's own paradigm. Because I feel like a lot of people that I've seen that have gone through those kinds of experiences, like the LDS 12-step programs for pornography use or something like that, they seem to come away with this pathologized view of that desire and arousal. It's not even about the behavior anymore. It's like if I can just root this need out of me for sex, and so that really ties me in knots because I'm like I don't quite know where the boundary lies between do I challenge this thought or do I just go that's their decision and.
I wish I knew. I think it depends on the client. There are several clients where you get the sense where I'm not going to be the one to convince them that they don't have a sex addiction or that they don't, that their language is incorrect or maybe not, that we disagree on that. And so sometimes you can give them a disclaimer and just say, I might view this a different way, so I want to go slow. I might describe this as an unwanted sexual behavior, but you seem to really identify with the language of addiction. So if I mess up, help me understand. Sometimes that's helpful. Like with that one couple that I described where he hadn't looked at porn in like 2 years. This probably wasn't the best decision, but I was like, look, dude, I don't think you've got a porn addiction. Like we can work on this. We can have some real conversations about your sex life and what you want, but I have a hard time labeling it that. They never came back to see me, so you can lose. Like there is a risk of losing them, and again, that might be where a referral is needed of just saying, if we keep hitting the stumbling block and saying, look, maybe we have a fundamentally different way of viewing this or talking about it, and I'd really like to see if we can work through that. But there also might be somebody somebody better suited to address the problem with the worldview that you're taking. I don't know if that's always the right answer, but because sometimes we are the best option, and realistically, people give therapy one shot. Sometimes, and if that one therapist couldn't help me, they might not go to another one.
Yeah.
So.
I think also sometimes people don't have the language to describe what they really experience, right? So people might say, I know a lot of people say looking at porn is porn addiction. And so they may come in and they may define their problem in a certain way. And when you say that's not it, they may not have any other words to describe it. And they may just feel like you don't understand them because you didn't accept what they said. And so I think that sometimes the best thing to do is to really ask them how has it been helpful for you? I'm sure when you were younger you didn't think of this as a porn addiction. How has it been helpful for you to think about it or label it that way? And then really push them on that, is it helpful? How is this helpful? Does it ever hurt you to think about it this way? Right? Help them to see how maybe stigmatizing their behavior helps, or giving it a label. Sometimes people come in and you give them a diagnosis and they are so grateful. They finally have a name for what they experience and they love a diagnosis. For other people, getting a diagnosis harms them. And so I think you really have to take an individual basis. But I think it is so tricky because we're using language and we all come from different experiences, and sometimes the way we understand things and the way our clients understand things are different, but somehow through language, right, we build those connections and we make change, and it can be tricky depending on who walks in the room.
For couples like this, I often refer them to Elder Oak's October 2015 Ensign article and have them tell me where they are the next time they come back, because he specifically talks about not labeling porn as an addiction. For most
okay.
people. It's the best article the church, I think, has put out
on
this very issue. But have them go read that, think about it, and then come back and tell me, where are you?
Yeah.
Let them kind of do some of the thinking.
Yeah. I feel like several people have kind of talked about that, right? Ask a question, let them do the thinking. Chances are they'll come back with a more balanced approach to their problems and to themselves. Yeah, trust that your clients have the capacity to do that, right? If you give them the space, right, they can do it. Okay. So yeah, be thinking about blind spots, right? Sometimes you may not even ask certain questions, things like that. So you may get somebody that comes in and they may talk about parenting problems. You may not even think to ask about sex, right? So be thoughtful about blind spots you have. You may have a client. Sometimes it can happen that you'll have a client come in and they won't really, maybe they're single and maybe you're in an LDS community and they talk about that, but really maybe they're having sexual problems with their girlfriend, but they are not going to bring that up, right? Because maybe they don't even want to disappoint you as their therapist if they know you're LDS, right? So be thoughtful about things that you're not asking. So it can be tricky, right? You don't want to offend by asking, but you also don't want to not ask. So I think that's why it's good sometimes to have a general assessment, right? Where you just go through a series of questions so they know you do this with every client. So sometimes that just opens the door. And then I think this is the last question, I'm pretty sure. Oh no, this isn't. Okay, the second to last question. Okay, do you ever overcompensate for personal beliefs that differ from your client's sexual practices? Meaning that maybe your clients come in and they say, we we're swingers or something, right? We do threesomes with people, and maybe that's against your beliefs. And how do you ever like overcompensate for that? Meaning maybe you don't agree with that, but you also don't want to like challenge. You're like, oh, okay, you have a different like moral system, but I need to be respectful that like you live life differently, and then maybe you don't challenge them on things that you might think are dysfunctional. Does that make sense? And maybe you don't see a lot of that here. I don't know. But there's a lot of variety in Texas.
There's a lot in sex therapy is sexual behaviors that we're uncomfortable with. We don't want to challenge. We don't come across as disapproving or too prudish, right? Like I'm so old-fashioned. So yeah, sometimes I see a lot of therapists like hang back and say, okay, I'm open. Like, how do you guys want to work this out? Rather than sometimes, especially when it comes to safety and some of those things, to really chime in and to ask some of those questions. So, I don't know. Did anybody have any comments about that?
Yeah.
I think I can relate. I've had several, like 4 couples who have been polygamous, but I hadn't known that until we were like into therapy, because all 4 times they've kind of like really downplayed it until I figure it out. You know?
Yeah.
And then you've built this relationship, and it's been kind of that situation you were bringing up, like, okay, I don't want to, like, I'm a little uncomfortable with it, with certain aspects of it, and I don't really want to, anyway, but then I also don't want to be like, well, I'm not going to see you, because they have a hard time finding a therapist, which is why they kind of lied about it for the first many sessions. So that's been kind of a hard for me, where I've just had to kind of decide, okay, with all 4, they hadn't had another spouse yet. Like, they weren't plurally married yet.
Mm-hmm.
We were like looking into it. So, but I think I was really, like, you're surprised when you find out.
Mm-hmm.
So I was like, the first couple times, I'm like way overly like,
Yeah.
okay, that's great, okay. Because you can tell they're embarrassed, they're afraid of what you're gonna think.
Yeah.
I don't know.
Yeah. Yeah, I like that example you gave where you're like, oh, okay. You like, your voice gets really high and you're like, sounds good. Yeah, so sometimes we can overcompensate. And I think that's something to, maybe seek supervision on, or a consultation if you're struggling with that. But I think that, that's happening, and it can be difficult, right? Like, I have couples who, I personally believe in monogamy, and, sometimes I meet people who are in polyamorous relationships, or they want to be, and so sometimes I know that it's just hard for me to believe that long term that can work out, right? And I don't know if that's really religiously based, or if I just think about it as triangulation, like you all like have some intimacy issues, so invite a 3rd person in, and then that helps, right? That helps, mediate the anxiety in the relationship. And so, sometimes I have to be really thoughtful about that. And, I've had clients where, I had a client where he'd been cheated on by his first wife, and then he was in a relationship with a second, and they kind of were engaging in this, I guess, this trend called hot wife, where you kind of post, I don't know, they had like some account, and they posted pictures of her, and it was kind of all about her getting another partner, not him. But I was like, is this a way for you to control how she cheats, And because that's what I truly believed, right? And I felt like I could just accept, right, that this is a sexual preference that I personally don't believe in, but they believe in, and maybe I don't challenge on that, since he's not saying it's a problem. Well, he kind of was saying that it was a problem, but right. But when I said that, he was like, yeah, that's definitely it. He's like, that's definitely part of it, is that it gives me control over how she would cheat, because my first wife cheated, right? So sometimes it's important to think about the overcompensation. So be aware of that, because that can happen too. And then, so how do you tell the difference, and this is kind of along those same, how do you tell the difference between dysfunctional behavior and a behavior that contradicts your personal beliefs? And that can be hard.
I think using that immediacy though in that moment and allowing them to answer back, you know, if we push and they say, no, really, it's not my attempt to control how she cheats. Oh, okay.
Yeah.
Right, but we can push them on it and they can say no.
Yeah.
That's not the case.
Yeah, and I think clients appreciate when you're honest, right? I said, I gotta tell you, I am biased about this. I have a hard time believing that this is really gonna help if you're having problems. And I think my honesty about that lets him pick and choose how much he wants to listen to me, because I've admitted that I'm fully biased when I say this, right? And then he can take it or leave it, right? And then I think it lets the client define, well, this is the problem that I want to work on, right? And I think, as helping professionals, we don't get to choose how we better our clients, right? A lot of people quit therapy and we're like, you really need to improve more, right? So we don't always get to choose that, but we get to help them with what they're willing to let us help them with, right? They're kind of like, that's kind of like how children are, right? I'll let you tie my shoes today, but not tomorrow. So, okay, any other thoughts before we move on? Okay.
So let's talk a little bit about sex assessment. We mentioned that being able to assess early on is really helpful. Like with that example that Rebecca just shared of, is this another way to control how your wife cheats? She wouldn't have known that unless she had a clear relationship or sexual history about about what was going on with the client. I think nothing compensates for good assessment in practice, and there are some really good assessment measures that those that are in private practice or even working in agencies, if you work with couples, or that you can use these. I forgot there was another slide before this. Let me talk about this. So therapists don't talk about sex, and this is one big problem in our field. And this is why I think it's important to drive home why we need to take time to assess for this. A lot of times we don't assess for it because it's not. We don't see it as directly tied to what the clients are bringing in. Maybe if they're not talking about it, we don't need to bring it up for them. And sometimes there might be truth to that. Maybe we don't. Maybe if it's not related, maybe it's just not central. But taking the time to understand is important. So a recent, this is a not so recent study, but one study, it looked at all health professions, many health professions, and it compared across health professions. And there were actually no differences between health professions, doctors, nurses, mental health professionals, in how much they addressed sex or assessed or took a sexual history. So 90% thought it was important. 86% said that they didn't have enough training on addressing it, and 94% were unlikely to discuss it with their patients. So while many therapists think this is a great idea, and it's really important, it just doesn't happen, right? And I think this with myself. I do a lot of sex research. I do a lot of sex therapy, and there are times where even I get timid or embarrassed or for some reason I just don't ask about sex. And so it's important to think about where you're at on that. When it comes to the assessment of sex, this is the DSM. Those who have taken a sex therapy course should be aware with this. There are 5 main types of disorders: desire disorders, arousal disorders, orgasmic disorders, pain disorders, and paraphilias. So we're not going to do an exhaustive overview of what these are. Hopefully you can get some training in that. But when we're assessing, it's important to understand where some of this comes from. So a lot of this comes from Masters and Johnson's model of why is the word not coming?
Sexual response cycle?
The sexual response cycle, there it goes. Which essentially just explains how we get from this flirting, this arousal, excitement stage to the aftermath of sex, right? So some of the things to look at, these are some assessments that I think are helpful. And all of these are free use. So in order to use them in your clinical work, you don't have to pay. If you use them in research, you do have to pay. But the new sexual satisfaction scale, this is just a simple sexual satisfaction scale. It asks about several different areas of sex, but it also asks, has satisfaction with my own sexual functioning and also satisfaction with my partner and their sexual functioning and their sexual, it's more than functioning. It includes sexual behavior, sexual attitudes, as well as just global areas about sex, my sexual frequency, sexual variety, things like that. So, so I think that's helpful to just have clients fill out. Anytime I have a couple, I just have them fill it out. It's 12 questions, really quick, doesn't take a long time. And that way you have at least a quick global assessment of how satisfied they are. And usually if you can tell they're a problem, sometimes I'll have them fill out different assessments or give different options. So another one is changes in sexual functioning questionnaire. So this is helpful to understand. This is working more toward diagnosis and assessment of what the sexual problems are. So it works with these different areas of desire, sexual pleasure, arousal, excitement, orgasm, and it kind of allows you to give a timeline where there are times that you've been able to orgasm. Have you ever been able to orgasm? Are you orgasming now? So things like that. Are there changes in your sexual functioning? This GRIS assessment, which is the next one, there are a male and a female subscale, which asks specific, they're useful in helping to work toward a diagnosis. So I should give a disclaimer that assessments never qualify as a diagnosis. If you're going to diagnose somebody, you should whip out your DSM and use all the criteria and work with these. But these help you give an idea of where the problem areas are. It'll assess every area of kind of that sexual response cycle, whether it's an arousal issue, an excitement issue, a orgasm issue. So it helps you kind of recognize what's going on there and what's happening. So this next one, the sexual symptom assessment scale. This one I think is helpful, and I put this on here because I remember working in Utah, and I remember how many couples presented with problematic sexual behaviors, sexual addiction, porn addictions, right? It's a quick assessment that just gives you an overview of when their last time was, what's the problematic behavior, how often are they engaging in it. It gives you a quick assessment that you can look at to get an overview of what this problematic behavior is to them. And like in this conversation that we've been having of how they define it and what that looks like for them, this gives them kind of the freedom to write that down and give that to you before you start putting a label on it or lead with your own assumptions about their sexual behavior. So that can be helpful. And then I just tacked on a last one here. Female Sexual Function Index is an extra one that works specifically for females, but looks again at all of the areas of the sexual response cycle. So these are helpful to use. Maybe it's boring. I know a lot of therapists feel awkward about having their clients fill out assessments before sessions, but this can give you a clear picture of what's going on. It can also help you have a clear picture of what progress is being made. Are they making progress in some areas and not others? And so, oftentimes through sex therapy, things get worse, just like in regular couples therapy, right? Things will get worse in the sexual relationship before things start to get better. And so it can be helpful to kind of track that progress and recognize what's happening. When it comes to assessment, we should never work in isolation. Healthcare collaboration is is important. And I say this because a lot of people just don't know what to do when it comes to collaboration and working with other healthcare professionals. So, whenever I have clients with sexual issues come to therapy, I always ask, when was the last time you saw your primary care physician? When was the last time you had a checkup? When was the last time you got blood work done? If they're having, if as I'm assessing, a lot of their sexual problems seem biological in nature, it's important to ask, are they seeing any specialty physicians? Are they seeing a urologist, an OBGYN? Some of these things that that can be really more specific to the genital areas and sexual functioning. Also, are they a psychiatrist? Are they on medications, right? That can have a huge impact on their sex life. Let's see, and are they seeing a physical therapist, right? A lot of sexual issues can be addressed with physical therapists as well. So what to ask about? Getting a full physical, like I mentioned, getting a pap smear, a testicular exam, prostate exam, getting blood work. A lot of the sexual issues that we find often have hormonal issues along with them. So when their last blood work was done, and are their levels normal, the medication that they're on, how to handle that. Usually, a lot of therapists might not know this, but one of the main side effects for an SSRI or an antidepressant is sexual dysfunction, right? But the great news is there are other medications you can add on, and there are other ways, sometimes switching a medication can be really helpful in that. So if we're not assessing for their medication use, that can have a big effect. So also checking that, chronic illness and hormone levels is important in that. So, when it comes to medication use, right? Doc, can you write me prescriptions for Viagra? This is why we think sexual communication is important. When Viagra actually came out, there were several studies that pointed out that especially geriatric couples, divorce rate went way up, and a lot of times there were like huge shifts in sexual frequency and sexual desire, and it was an option that suddenly was newly available, and it was a new conflict that couples had to deal with, right? But also it's important to ask what are medications being used. I've worked with a lot of young couples, 28-year-olds, 23-year-olds even, that are using Viagra on a regular basis, or Cialis, and if you're that young, you shouldn't be using a medication like that. There are other ways and things that we can work on to get to resolve those issues. So, and in looking specifically at sexual communication, there are some helpful assessments. One is to look more at sexual communication content. There's a scale called the Sexual Self-Disclosure Scale. This one I think is helpful to just see what topics are discussed within a relationship. So all it is it's a list of 30 topics related to sex, and people write down the extent to which they've talked about it with their partner, with their sexual partner. Are there topics that they do discuss? Are there topics that they don't feel like they can discuss? And some of that might be it just hasn't come up. And some of it might be that it's taboo, or they don't feel comfortable talking about it. So having that clearly in front of you, it just gives you a clearer picture of what the sexual communication looks like. Looking more at sexual communication processes. This is a simple questionnaire that just looks processes around when a sexual problem arises. This might be done just in assessment, but you might have couples where this is really a sensitive topic and they don't feel comfortable talking about it in front of their partner. So I find this is a helpful way to, when I'm working with couples like that, to get a clear picture of what the process looks like. When a sexual problem comes up, does one person bring it up? Does one person bury their feelings? Are both people able to discuss? Are there pursuit, withdraw dynamics? And it's quick, it's simple, and it just gives you a picture of how that's discussed. So, other ways that you can assess for sexual communication. Looking at, I liked your idea of a sexual timeline. You know, another way is a sexual genogram, right? Understanding the family history, and we often are trained to take genograms. I don't know how often that's stressed here at BYU, but getting a family history specifically of sexual communication. How's it talked with your parents? Were there any instances of sexual assault in your family? Did that ever, that can change an entire communication dynamic within a family. Were there ever clear conversations about the birds and the bees? A lot of parents think they've had that conversation, or they think they're really open to talking about sex, but a lot of times, right, as we all know, like they're just not, right? So getting that genogram, that background can be really helpful. I think we are going to take a break in a minute. Get ready. I think I meant to hit this button. I think it's helpful to do enactments. I think nothing's more helpful than just to have the couple start having a conversation in the room and see what that process looks like, right? I've had couples, I remember one time we were in this kind of a play therapy room, and we had this little kitchen, and they were talking about how their problems come up when he's trying to make a sexual advance and she doesn't recognize that. And usually happens when she's doing the dishes. And I was like, well, let's do it. We got a kitchen here. So having them act some of those things out, that can be really awkward for them, but can be actually really insightful, right? Can they talk about what that process is like, what they'd like to see, and can they modify that? Both pre and post sex. I don't recommend any sort of undressing or sexual act with the clients, but pre and post, fully clothed can be helpful. So, sculpting out those, what the dynamic is that they see, how they see that happening. Another one is getting them to not communicate. A lot of times couples talk too much about their sexual relationship and have a really hard time just being able to relax and experience it. So David Snart, she wrote Passion and Marriage, or The Sexual Crucible, which you may or may not have read in your sex therapy class, but he's got a lot of good ideas. But one thing he really talks about is hugging until relaxed. And he just has clients stand up and hug each other until they feel relaxed and present with each other. So sometimes less communication can be helpful. So, any other ideas that you guys have had in order to understand how your couples talk about it, or even individuals? We've been talking a lot about couples because that's kind of the focus of this, but getting individuals to talk about sex, or families to talk about sex, or things that you guys have tried. Yeah.
I realized in one conversation that they were really having troubles around using a vocabulary they were comfortable with. And so I gave them the assignment to go home and find a shared vocabulary that works for both of them. What?
We have to say penis louder and
I went to middle school. I know that game well. Yes, I do. I never thought about doing that with clients, so that's a good idea.
Yeah.
It might get them just comfortable saying the word, right?
Right.
Yeah, that's a good idea.
Yeah. Exactly. Go out, yeah, play the tennis game 3 times this week. That's right.
That's right.
Not a bad idea.
I would add vagina to that game, honestly.
Sure.
Females are so
Honestly, yes.
like, oh, it's just yucky, and I don't want to talk about, I feel more comfortable talking about his penis than I do about my vagina. So
Yes.
I would switch it and be like, let's play the vagina game. You need to
Yeah.
say vagina.
Yeah, you could do it with any word they seem to be uncomfortable with, right? Yeah, I think I've done
Oh,
what.
did you have something else?
Oh, no, just with the enactment, it just brought up a memory with a couple, that I think that is particularly, important, because that really helped me understand how it is that they talk about it at home. Because the man was, the husband, he was very frustrated. He's like, I have no idea what it is that she wants. She tells me, I'm telling you, and you just don't get it. So I'm like, okay, so let's have you tell him right now what it is. And after she was done, I'm like, I can see why you're so confused. I was like, I am a woman and I don't know what you want. So that was very, very helpful. I think I would really second doing enactments because that really helped me see that it wasn't just frustration of kind of like, I understand what you're saying, but I don't want to do it, which was what she thought it was. Like, you understand, you just don't want to please me. But then after she said it, it was very clear that I don't think you know what you want.
Right.
Because this is as ambiguous as they can get, and she kept giving examples from movies. Like, this is how I want you to act. And I was just like, okay, that is like, it was very, very confusing. So I think in that sense, it really helped me see, like, okay, in this case, he really is confused. It's not that he doesn't want to please his wife, it's just that it is really confusing. She's confused.
Mhm.
Everyone's confused. I am confused.
Yeah. Yeah. Very true. Yeah.
I work with a lot of single students who are struggling with pornography and whatnot, and often there's a real kind of sense that they're disconnected from their own sexuality. And it sort of gets acted out, kind of externalized through pornography use and whatnot. And so it's part of some of the work that I've done with some of them. If I see there's problematic beliefs underneath that, we identify those kind of core problematic beliefs. I'll help them come up with mantras. And I was working with a young man recently. He could only say parts. He couldn't say penis, And so we kind of came up with a mantra like, my penis is good, right? Sexuality is good. And he had to, like, every day go home and meditate on this mantra of, like, my sexuality is good and I am good as a sexual being. And it was just this very kind of liberating experience. But, he's not sexually active, but there's still a kind of fragmentation there that some of this kind of cognitive work has helped kind of heal. But I see this as like, there's a trend, I think, of some of these beliefs that get in there and undermine just a healthy relationship with self as a sexual being.
Yeah, I was actually supervising a case, and there was an issue. There was like an issue. I don't know if it was with pornography. I don't think pornography was involved, but it was with excessive masturbation, and so I had advised the therapist to not necessarily challenge the client on the masturbation, but to have the client focus their masturbation on like love of self, like as more of like a meditative becoming one with your body experience. And the interesting thing that about like a lot of these sexual problems that people present is like it becomes more of this like physical appetite or disconnection from self spiritually. And so sometimes when you just go in and you want to approach it and you say, just stop doing that, right? You're denying the sexual part of the person or the part of the person that is in touch with their body, because a lot of times the viewing of pornography or masturbation is to escape themselves, right? And so sometimes if you can just get them to change the way, right, that they're even interacting sexually with themselves, you'll see that all of a sudden it's no longer compulsive because they begin to see their body as part of themselves. It's not something that they're trying to disconnect from. And so that's something, anyway, that just kind of reminded me of that, like how disconnected, right? I can't even, it's a part of my body and I can't even name it. Yeah, I'm looking at parts of other people's bodies, right? It's all, sex is all around me, but I can't own that I'm a sexual being, right?
And what's tough in instances like that is self-hate becomes essential for arousal if that continues, right? And so that can perpetuate into marriage or can perpetuate the relationships is I can't love myself, and it's it's almost like that for a lot of people. And that sometimes is a dynamic that can be really confusing for, especially for women who may not have masturbated or may not have spent a lot of time, may not have experienced that. Is that I've spent my whole life really, sex has always been disconnected from me, right? And sex has always been a self-loathing experience. And sometimes, if that perpetuates, it can really lead to a dynamic that's painful to fix. Sorry, somebody had a comment.
Yeah.
Oh,
Yeah, it's just on what you're saying as far as, I believe we need to focus on the fact that sex is a relational issue, and to focus on, especially single BYU students who are masturbating, viewing porn, to disconnect from the porn by thinking this is something I want to share in a relationship in the future. And I found that people, once they disconnect and try to think of it in a future relationship, it really calms things down quickly too. Focusing on this is a part of you that you get to share in a marriage relationship. Think about the relationship in the future. And that really calms things down.
Yeah, and I think, pornography makes it really easy to think of it as not a relational thing, like something I'm doing in my room, on my computer. And if that person was here, right, if that person actually came in your door, would you be doing the same things, right? And yeah.
I was just gonna say, not everyone though necessarily maybe views that as a relational thing. Like, not everybody thinks pornography is harmful. I mean, it was on that top 10 list that happy satisfied couples look at pornography together. So it could be like, maybe, I don't know. Anyways, just taking into consideration what their beliefs are and how they want to do that too.
Yeah. I mean, I think that's important to realize, right? That when you're working with clients, you may disagree on things, right? Not everybody will view things the same, and so you've got to work within the context of what they bring in. Yeah, that's a good point.
On that survey though, it said they viewed it together. That's a relationship, right?
Mm-hmm.
That's
Yeah.
the relationship.
Yeah, and we're not necessarily endorsing per se any particular sexual behaviors. That's just what people reported, right? But it is, I think it's important to realize that if you don't ask questions and you don't know, I mean, people may be viewing it together. For some people, they may be equally invested. For somebody, they may feel like they have to do that, right? And so if you know that people are reporting these things, it's not always clear how much the behavior they're engaged in is mutually rewarding, right? But it is important to know that 40% of happy couples are doing that, right? And we don't know if they're like, we don't know the longevity of that or whatever or whatnot, but those are things that people are reporting that they're engaging in. So it's important to know.
Yeah.
I know this is changing the topic a little bit. One thing that can be both an intervention and assessment is when we tell a couple they cannot engage in sexual intercourse during treatment. For whatever, if it's for an intervention or it's just an assessment, and looking at the reaction and then having them talk about that reaction with each other. I have a couple right now that they are on probation. And it's been the best thing ever because now they're having sexual communication because it's off the table. And he was like crying, like jumping up and down when I told him he couldn't have sex. And she's like, thank you. Like, I need this. I need to feel like I'm not an object and that I'm desired and wanted. And then for them to be able to say that to each other, like, help me know exactly where they stand and how things can now change for them, and for them to realize that too.
Yeah, I've done that with couples, and it was a case where he wanted to have sex, nearly every day. She wanted to have sex maybe 2 times a week, and it didn't seem like their desire was. I don't know. I was mostly just stuck, but I eventually was like, all right, we're not having sex at all this week, and we're going to see how that goes. And I actually gave him a sensate focus assignment, which with sensate focus, you're not supposed to have sex. It's to remove the focus on orgasming, and it's just to kind of sit there and be present with each other and massage each other and whatever that is for the first phase of that. And I gave him that assignment, and they came back the next week, and he was like, I didn't know sex could feel like that. And so he was like, I feel like I've been chasing after this, this thing that I've never known that I could have, and suddenly this week I experienced it. And for her, it was like, oh man, that was the sex I've been waiting for. So both of them came back, and I don't know if it worked out well every time, but I was like, all right, yeah, that's good. Because really, I was just frustrated. I was like, no sex for you guys. I'll show you who's boss here. I'll show you. But they somehow it works. So sometimes we work in spite of ourselves. So, but yeah, I think that's true. As I thought more about why was that effective? They they had to talk about it. They kind of met in the middle and experienced something different. And for them particularly, it was very new. So, well, let's go ahead and take a break. We'll do about 10 minutes, if that's okay. So about 10:02, we'll get back together and finish this thing up. But thanks for all of your comments so far.
Okay. So we'll go ahead and start because I want to make sure we get through everything. So we're going to watch another video clip. This is from a movie called Hope Springs. It's with an older couple who goes away for the weekend to get some marital therapy, and they've been given an assignment to kind of just cuddle and lay there in bed and kind of be more more affectionate, but we're not assigned to have sex or be sexual per se. So just to be cuddling and in the same bed. So we're gonna go ahead and watch this. So what are some of your initial thoughts about the video?
I hope when I'm doing therapy it's not that awkward. Because I don't feel that awkward when I'm a therapist. My clients are inside they're feeling like that couple is feeling.
Yeah. Okay. What else?
We're laughing about it, but when the couple is experiencing this, it is actually very vulnerable.
Yeah.
Whereas the movie, that you're not laughing in the session. It is awkward and very vulnerable.
Yeah, and you see the actors how they're moving, the characters she starts buttoning up, right? Trying to cover up as much of her as she can. You see as he opens up more, he actually physically moves away from her. But it can be very difficult for couples to talk about this, and you see how both of them how she doesn't even report having fantasies, and then he's talking about Carol and the corgis, right? You just see the divide between them, right? That their sexual lives has not been a shared experience, right? Other thoughts on?
I like watching the therapist be the calm in their storm.
Mm-hmm.
He knew what he was doing and why, and he felt confident what he was doing, so he could let them sit in that and let them experience that.
Yeah. Yeah, I like how he says there's no wrong answers, right? He really helps them to feel more comfortable to kind of explore and open up about this, these parts of them. Yeah.
I liked how he asked specific questions, but there was a point when I was stop asking questions and just let them talk, because I felt there was more to it. So I thought there was a beauty to asking questions that help them understand and articulate, but then also stepping back and letting them be able to work through their feelings and articulate them themselves.
Yeah. Yeah. I also thought that too, but then I also realized this is like a movie with a plot line. They're trying to push, so maybe that's why.
It was kind of sad at times where he would give those kind of clarifying comments, give or receive, and she was like, what? To me it was sad, the naivety, the lack of experience.
Yeah. Yeah, and I like how he did it a lot of times in the form of a question, right? Rather than saying whoa, you don't know a lot about sex, or you don't have fantasies, right? He's asking questions, and I think sometimes asking questions is a good way to help people be more introspective about I've never really thought about oral sex as giving and receiving. Maybe she hadn't had a lot of thought about it, which kind of shows the lack of openness in the relationship, right? It's not necessarily always The discussion of fantasies isn't necessarily important to whether or not people act out on the fantasies, right? I think a lot of times people have fantasies that they don't want to act out on, but being able to be open about that, I think, is a different, is a different thing.
And I think I've even seen some couples that might be even like worse than this, and that like I was actually I was watching this case. I wasn't the therapist, but I remember they were trying to get an idea of like the sexual education. That it was a young couple that was just transitioning into marriage, and the woman said like, my mom, like all I know is my mom told me it goes in the third hole, and that's all I know. and we were all behind the mirror like, I don't even know, like where did she get that, right? Like, and anyway, so yeah, like really, like, and if you were talking about oral or anything like that, she would have just been confused. Like she just, sometimes you have to do a lot of education, and there's a lot of not knowing, right? Which is surprising when it's your own anatomy, that how unfamiliar people can be sometimes. It can really shock you.
Yeah.
So
I think another thing too that I like that this points out is that men and women are socialized differently when it comes to sex. So the guy is like, of course, of course, of course, and she's like, no, like I have no clue what you're talking about. And so recognizing that when a couple shows up, that the man has probably had a lot more experience with sex, right? You could get a woman who may not even know where her vagina is, and you get a man who has masturbated, looked at pornography, and this woman, right, gets advice from her mom, like, put it in the right hole, right? And so you'll see that you have, a male that has developed sexually in some aspects, and then a woman who hasn't developed sexually in terms of knowledge or communication or and so you get that, and then so what you get is a man who can come into a relationship and it feels fairly demanding to the woman, right? Like he knows all these things. He can have sex and it works because it's penetrative sex, and so it's always going to be satisfying for him. Women don't even know that they have a clitoris or how to orgasm, and so you get these discrepancies, and so you have this man who's ready to go and this woman who would maybe just like, to just have him touch her boob, right? Like, let's start there, right? Like, and so those discrepancies can really create problems that last long term, right? And so those are things to think about, that they don't have the same language to even communicate, right? They don't have the same experiences always.
yeah. So we want to talk about some of the research we've done on this topic, and I recognize that might be really boring. So if you have like questions or comments or funny stories, feel free to share them at any time. But we'll try to keep it interesting. I want to talk about. I mentioned I did a study on sexual communication for my master's thesis, and so what we looked at is. We did a survey of couples. We had 142 couples, which isn't a huge sample, but I felt really proud of that. And so we asked several questions about their sex life, about their sexual outcomes, about their sexual functioning, their satisfaction, and then we also asked about their sexual communication. I talked about two of those sexual communication measures earlier, where one kind of looks at the extent to which they've talked about sexual, like different topics, sexual communication content is what we called it, and then the processes around how they talk about sex. So we looked at how these two things, sexual communication content and sexual communication process, how that influences sexual outcomes or relationship outcomes. We also looked at how it influenced sexual functioning. And one thing we did is we compared it to how people communicated about general problems in their relationship. So we also looked at just general communication processes when various problems arose. What were the communication processes in working toward resolving those problems? So what we did, I'm going to show a picture that's going to be very confusing to make me look really smart. No, that's not the point, but I want to point something out. This is what we found. So one thing I thought was really interesting is when we looked at sexual communication processes, and this was true for males and females. We looked at, so the processes around how couples communicated about sex, they were related to sexual satisfaction, but they weren't related to relationship satisfaction. And when we looked at general communication processes, they were related to relationship satisfaction, but they didn't predict the sexual satisfaction, which really stuck out to me. There was this clear link that the way that we talk about sex might not influence the other areas of the relationship, right? Which I think a lot of times as therapists, there is this idea that when couples come in, a lot of therapists are timid to talk about sex, or might not, we might have the assumption that if we help couples communicate about all the other areas in their life, that their sex problems are naturally going to improve, right? And I don't think this is to say that relationship and sexual satisfaction aren't related, because that's certainly not true. But to say that these communication processes, learning to communicate about sex, might be an important skill that couples need to learn, right? And it might be a unique skill that has different effects. Looking into more of the literature out there, there have been some interesting studies. There have actually been several. There was a review of several. They were several clinical trials for a female arousal. It was essentially a female Viagra. It was supposed to stimulate lubrication and arousal, right? Several times the clinical trials failed, and so this study looked at why are these studies failing, and the one thing they found was that whether you were on the placebo or on the medication, you were talking more about your sex life, and that improved your sexual outcomes. And so everybody was improving, both the placebo and the treatment group, and so we weren't really seeing a lot of differences. So we also looked at how communication influenced the sexual outcomes in terms of sexual frequency and orgasm frequency, and it was interesting to find that more women talked about sex, the more they reached orgasm. And so, so being able to talk about it is a unique skill. It has different effects, and it can influence how satisfying your sex is. Orgasm isn't always the marker for how satisfying a sexual experience is, and I recognize that. That's a limitation in the study. But in terms of an outcome, there's a clear indication that being able to talk about it matters, right? So I think it's important to consider that the way we approach, or the things that we assume about sex and couples' relationships may or may not be true. It's important to have those conversations with couples and bring it up, because most of the time, like we've already talked about, the minute you bring it up, some people are like, yes, like, please, can we talk about this? Or one partner might be afraid to talk about it, or both, like in that video clip, right? But just like a lot of diversity issues, or a lot of anything that is often uncomfortable to talk about, if you don't show that you're willing to bring it up, clients oftentimes won't, right? Clients may not feel comfortable, or may be worried about your judgment, things like that. So it's important to be the one to discuss it. This was just a list of a couple things that I've already said, so we don't really need to talk about that. But so the next kind of study that we wanted to do was to understand, well, so how are couples talking about sex, and what do those processes look like, and how can we understand that and work with it? So Rebecca's going to talk a little bit about another study that we're working on.
Okay, yeah. So Adam ran what's called a cluster analysis, and what it does, the cluster analysis, is you kind of find people, groups, participants together who have like scores on different scales. And what we found was 4 different groups that came out, and there was a mutually satisfied couples group, a satisfied men, dissatisfied women, and satisfied women, dissatisfied men group, and then a mutually dissatisfied couples. Now, sometimes there were a few participants within each group where it was flipped, but at least each of these were primarily satisfied men and dissatisfied women. But at least one partner was dissatisfied and the other one was satisfied. So we found these 4 different groups that arose from that, and then they had answered some open-ended questions about their sex life. And so what we did is we went through and looked to find some patterns in the behaviors of each group, right? What was unique about the groups? What did we notice across groups? And so we looked at sexual communication behaviors, so what they were doing, okay, behaviorally, in terms of how they were communicating about sex. Decision-making processes, how does this couple come together and make sexual decisions, right? That's a way of communicating. How do we actually decide what we're going to do sexually? And then the outcomes from their sexual communication. Okay, so here's a summary of our results, and I'm going to go over each each theme that we found. So here's the different groups, the behaviors, and then here are the different behaviors that we found that arose. So first was mutual enhancement, and so what we noticed was that there were a lot of couples that talked about how they would communicate about improving or enhancing the sexual aspect of the relationship. And so here's a quote that kind of talks about that. It says, "We talk about how we each feel sex together, sex in general in the world, and people's ideas about it. We talk about what we are comfortable with, ideas to try, the role it plays in our marriage and relationship, and how fun it is and important, but not all there is in marriage." And so you'll see here that the mutually satisfied group, right, 78% of those people are talking about sex in a way that is mutually enhancing, meaning that they're coming at these conversations with the idea to improve or enhance this part of their relationship. It may be already a satisfying part, but they're proactively talking about this, right? Talking about ideas, talking about things they want to do, how they feel about it. You'll see that it happens a little bit less in these groups, and then you'll see that in the mutually dissatisfied, it only happens 25% of the time. Okay. Another behavior we found was complaining. So this is when a partner only initiates sexual communication when they are dissatisfied with some aspect of the sexual relationship. So this can look like someone bringing up the fact that, like, I only talk about sex when I'm like, I wish we had sex more. Okay, so maybe they're not like whining about it, but they're issuing some sort of complaint in some way. So usually the topic is brought up when one of us feels like the current frequency is low. So there were a lot of people that kind of talked about only when it's becoming problematic to one partner do we talk about the sex. Okay. And then there's doesn't come up. So some couples report, oh, sorry, you know what? I wanted to kind of show you these statistics. So, right, we see complaining happens a lot in the mutually dissatisfied groups, okay? And not quite as much in the mutually satisfied group. And then you see it will happen moderately here, okay? Doesn't come up. So this is when the couple just doesn't engage in sexual communication, not necessarily because they're avoiding it. They're just like, it doesn't come up. We just don't talk about it. And they say, we really don't talk about sex that much, not because we're uncomfortable, it just doesn't come up that often. So something that's really interesting on this one is this is the lowest statistic in the table, and you'll see 7% for mutually satisfied couples. So to me, what this means is mutually satisfied couples talk about it, okay? The thing that they don't do the most is not talk about it, right? So learning to communicate about this is pretty important, right? It's gonna make a difference. And then you'll see that the percentages are lower here. Are a little bit higher, but they're still fairly low. So most people are in some way talking about it sometimes. And then there's disengagement. So this is when one partner actively avoids or refuses to talk about the sexual relationship. So that mean that one partner is trying to initiate discussions and the other person is like, no, I don't want to talk about it. So one respondent said, I really struggle with talking about our intimacy. It's very uncomfortable for me to discuss with anyone, even my husband. So, right, we're seeing some individuals that just say it's really hard for me to talk about. Sometimes we get the partner kind of saying they never want to talk about it when I try to talk about it. So it could be either partner talking about it. So these are some of the behaviors that we're noticing around sexual communication, how they're actually communicating. Then when we look at the decision-making process, so how they make them, we're going to first look at sexual relationship building. So similar to the mutual enhancement where they're talking about what they can do, this is where they both kind of approach the sexual relationship with an attitude of openness, being willing to act on suggestions from their partner, contribute suggestions, they're honoring boundaries. So sometimes they will talk about boundaries that they've set up and they know that they can offer suggestions within those boundaries, but there's generally a sense of openness in the relationship. So one respondent said, if one of us has an idea, then we share it and almost immediately try it. We don't usually talk about it unless we are having sex. If it doesn't work for one person, then we know we can say that we don't like it. But if it's working great for the other person, then the less enjoyer will usually stick it out so the enjoyer can have a good moment. We do this for each other. So we see like a lot of equality when it comes to the decision making, right? That they're both active participants, they're both bringing solution, like suggestions, they're both being open to the influence of the other partner, they're both respectful when something isn't working out, right? And you'll see that mutually satisfied couples do this significantly more than other couples, okay?
It's also interesting that the mutually dissatisfied group, there was 25%, which isn't a lot, but one thing that we noticed a lot as we were coding the responses from the mutually dissatisfied group is that they oftentimes had very differing stories. So one partner would say something like, oh, we talk so much about this, we're like both so supportive and giving in, like open to the other suggestions, and then the other partner would say something like, oh yeah, it doesn't come up and things are awful. And anyway, like there are very opposite stories, which is just something to look for when it comes to the clinical couples that you see. Is one might feel like everything is great, or they at least might report that. When it came to their other sexual outcomes and sexual assessments, they came across as dissatisfied. They usually had lower scores, but at least qualitatively they might report that things are great. So.
Yeah. Okay. Okay. And so compromise. So this is the successful meeting in the middle when partners have separate goals. So sometimes, right, they may have very differing libidos. They may have different thoughts about how often sex should occur or what sex should look like, but somehow they achieve some middle. So they never really reached a consensus, right, where they both found a solution that they fully met their desires, but they met in the middle and then they both feel really content with that. So one respondent said, we use a reward system. I love doing the dishes now. So I guess if he does the dishes, he gets sex, and that works. It works for her, it works for him, right? And then sometimes it was about scheduling sex. So we typically schedule sex, but we are busy with kids, so this works very well for us. So maybe they wanted it to be spontaneous, but then they have a compromise. We schedule it, and it works, right? So we see that a little bit less in the mutually satisfied group, and then you kind of see some variable rates here. But a lot of couples are doing this. Manipulation. So this is when one partner uses guilt or pressure to change the other's sexual behaviors or uses sex to manipulate the other partner. You'll see that this does not happen very often in the mutually satisfied group, right? They're not using manipulation. You don't see this in the satisfied men or dissatisfied women group very much, but you see it quite a bit in the mutually dissatisfied group, right? There's a lot of manipulation. So one respondent said during periods of heightened stress or insecurity, she sometimes wants to engage in sex so as to say what she thinks I want, right? So it feels like she's trying to use sex, like she has motives with her sex as opposed to just genuinely wanting to be intimate with her husband. And then another respondent says, he tries to tell me what I should be doing and how I'm feeling, gives me a lot of negative feedback. So sometimes they'll give a lot of negative feedback about the sexual relationship, be maybe critical in a way that is demeaning. We also had coercion.
I have a question.
Yes.
Do you guys have anything to say about the differences between 2 and 3, specifically with manipulation? Because you have half as many in 2. You have
Yeah.
satisfied men, dissatisfied women. And I'm wondering, like, when you have a lower desired partner, and this idea that, the lower desired partner tends to have more power in the relationship, does that then, do you see that in this, or anything that you would expound on?
Yes, I do. Well, did you want to comment on that?
No, I think it was interesting that when men were dissatisfied, and that was something, at least coding wise, that the manipulative behaviors, the guilt, often came across a little bit more from the men, and so not always. I mean, there were several reports the opposite, but interesting that when the male is dissatisfied, that comes up a little bit more.
Yeah, meaning that
She's seeing it as that she's using manipulation?
no, he. So we have something for that. So this is the way we coded this. So manipulation is when the person like verbally guilts the person for maybe not wanting to have sex or is critical of the sex. And so when men were dissatisfied, right, and they weren't happy with the levels of sex, a lot of times the woman would report like feeling kind of pressure or like he was guilt tripping her. Or criticizing her for not wanting as much sex. We have another, and you'll see on the next, it's gatekeeping. So gatekeeping is when a low sex person is not manipulative, but is refusing. So it's kind of like, so it's not manipulative because it's not like guilt tripping or per se pressuring. It's more of a refusal. Does that make sense? Do you feel like I explained that well?
Yeah, does that answer your question?
I think so.
Okay.
So then, my question, go to gatekeeping number 2, I know we haven't gone there yet, but 51%, is that saying that 51% of the men reported?
It's 51% of the couples.
So if it showed up in the couple
and it can be vice
dynamic.
versa because sometimes there were men that refused to have sex.
So
Or
this isn't
this is not in individuals. We decided to do it in couples. Yeah, we do have the data for the individuals, but it
In
was
the
gonna
published
be,
paper, it'll be separated. Like
yeah,
we'll have
but
combined and separated.
we just thought for presenting it, it's so many, so many numbers. We decided just to do it based on the couples, the occurrence of the couples. So here, let me go back a little because we'll get there in a second. So coercion, the quote that, this is forced sex, unwanted sex, or when a partner doesn't give consent. And so somebody did report, when he is in a bad mood, he threatens me and sometimes tries to rape me. I love having sex with him when I'm not scared, but I don't think you should force me to be close to him when I don't want to. He thinks that since we were married, I have no say in the matter. And because we had manipulation, we really tried to make sure that this was just coercive, right? Rape or unwanted sex, some kind of forcible. And that really only occurred in the mutually dissatisfied couples. Okay, so gatekeeping. Okay, so this is when one partner consistently controls the frequency and variety of sexual interactions. Okay, so I've told her that I don't want to have sex with, I don't want her to have sex with me unless she actually wants to. That's resulted in us just having sex just a few times a year. And then a lot of times people, like women would report, I tend to control the frequency of sex. We don't do a lot of negotiation with it. He requests and I either say yes or no. There isn't very much discussion with it. And so you'll see that that doesn't happen in the mutually satisfied groups. And that's kind of what I was talking about in terms of the openness, right? There's openness to suggestion. Like if you want sex and I don't want sex, I'm more open to well, you express a want and a need and a desire. And we're always going to try and meet that for each other. And you'll see with gatekeeping, right, there's kind of a refusal to do that. And you'll see that in the satisfied men, dissatisfied women, and the mutually dissatisfied that these are highest, that this is being reported. And sometimes, even though it says satisfied men, the interesting thing is that even though sometimes it would say men are satisfied women, sometimes the person that is satisfied, I'm trying to remember, they still might be having high orgasm frequency or be getting the sex, but their partner's attitude is kind of negative. So in some ways they're sexually satisfied, but they can still be upset with their partner. I don't know, do you have any other thoughts on that? And those groups were probably the messiest ones to sort through.
I think that's really confusing.
Yeah, it is kind of confusing. And so, okay. So then we have how couples talk about sex. So in the mutually satisfied group.
These are the outcomes.
Oh, these are the outcomes. Sorry. Yeah, sorry. I read that, and these are the outcomes. So 56% reported feeling like an emotional connection after following sexual communication. So, and sometimes they were referencing sexual communication or maybe the sexual relationship, but they talked about growing closer, physically moving toward one another, as well as on an emotional level. We are working towards a common goal. Objectives are usually met. And so it's interesting here that where satisfied women are, right, this is also occurring, right, showing that maybe the emotional outcome of sex matters for women's satisfaction, okay? I see that a little less here, and same with mutually dissatisfied. And that's an interesting thing too, is even though people might have had dissatisfaction, they did talk about how sex, sometimes when they are successful, they're rarely successful at communicating about sex, but when they are, they do feel the closeness, right? So it's a matter of maybe not being able to effectively do it all the time. Improvement, so we separated these two because we noticed that improvement is separate for a lot of people, meaning that when we talk about our sexual relationship, improving isn't always the same as actually feeling emotionally close. So this could be a physical connection, it could be sexual performance, or comfort with talking about sex. So some reported we have become more open in discussing our sexual relationship, so the more they discuss it, the better they get at being able to communicate about it. Some talked about being more adventurous now than at the beginning. Some women talked about, I now have a climax, for years I didn't. So they don't really report that they're like, sometimes the women wouldn't necessarily report that they were like super happy. You didn't get that feel from their responses, but you did get a feel that like, well, now they climax. So sex has improved, but there isn't quite a resolution to the communication of really feeling like they're on the same page.
Which I think that ties into kind of that thing that we found in that other study, was that general communication doesn't always necessarily lead to improved sexual outcomes, right? These were couples who communicated about sex. They saw improvement in their sexual life. But also the couples who communicated about sex, the percentage was lower of who reported that they felt a greater connection, right? So it's not, so being able to improve your sexual life, you need to learn how to talk about sex. Being able to just talk about things generally doesn't always necessarily lead to a greater improvement sexually or that enhanced connection. So that kind of supports that other finding that we found.
Yeah. Some reported a deterioration. So what this references is that the couple experiences discouragement, resentment, or distance after talking about sex. And so some examples: I need more romance to invigorate the sexual experience, but I'm resigned to believe he's just not capable of initiating that without reminders. And then another individual talking about, I grow exasperated and she cries and bemoans her lower sexual drive after children. So we see that when they talk about it, they don't really communicate to a resolution, right? They both leave kind of feeling discouraged, sometimes resentful, or right, that they just haven't effectively resolved that. And you'll see that that doesn't happen as much in the mutually satisfied group, and you'll see that it happens quite a bit here where one partner is dissatisfied. And then manageable despite differences. So this is sometimes, though the sexual communication has not resulted in reaching consensus or new solutions, the couple seems to accept their sexual differences. So one person said, I used to view our lack of sex as wrong and unfair. I realized that made me a victim, so now I accept it for what it is, and what it isn't, I ask for what I need. Right? So there are quite a few couples where they would report kind of, right, that things weren't exactly the way they want, but they didn't seem bitter about it, they didn't seem upset, they had come to an acceptance, right, that this is manageable. Did I kind of talk about that? So you'll see that that seems to happen a little bit more in where there's discrepancies and probably desire. Okay, arguments. So sometimes the couple reported that they would get in an argument. So sometimes we define that as like them reporting feelings of tenseness, right? Not everybody actually got in a verbal argument, but when they report that there's some kind of conflict or being defensive or shutting down. So they reported it usually gets tense. Oftentimes one or the other shuts down or becomes unresponsive or defensive. Another respondent, we don't talk much about our sexual relationships. Sometimes when we talk about it, it can result into arguments about other areas of our lives that we may be lacking, right? So they're showing that when we start to argue about sex, then we start arguing about a lot of other things, right, in our relationships. So You'll see that that doesn't happen very often in the mutually satisfied group. It's happening most with dissatisfied men and the mutually dissatisfied, right? That it leads to arguments. So helping those people to learn how to sexually communicate, right, could be pretty important. It seems like it always results in an argument. So then some people reported that nothing changes. So what this means is they discuss the sexual relationship. They maybe even make plans to make changes to their sexual relationship, but nothing ever changes. So they can kind of be stuck. So sometimes a respondent said, we discuss it, but don't necessarily enact the solutions. That's something we have to work on. So sometimes there will be couples who are able to talk about it, identify what needs to happen, but there's something keeping them from actually being able to do that. So saw that a lot with frequency, where the man was complaining about low frequency of sex, and the woman was like, yeah, I agree, we need to have more sex, but it just never increases, like nothing ever changes. So anyway, so we thought that this would be helpful in terms of thinking about how there's lots of, I guess that will be harder to go back to the different things, but thinking about what couples are doing, right? They're talking about sex. As far as decision making, they're both contributing, they're both open. And so I think clinically what that tells me is that if my couple in the room is having trouble with like discrepancies, it seems that they haven't drawn up boundaries, right? A lot of the successful couples seem to really know the boundaries, and they didn't push beyond the boundaries. And the couples, especially where one is satisfied, one isn't, there was somebody who constantly felt like their boundaries were being pushed. Right? That they had said, like, I don't want to do that, or I don't want to have sex, and they're being pushed. And so helping the couple to kind of be able to get to this place where they are able to communicate effectively, not just talk about sex, but also maybe set up boundaries. And then that allows for them to be more open, right? Because if we never really establish boundaries of what's okay, what's not okay, then it is hard to feel that sense of openness, because somebody's always making propositions that I feel are a violation of boundaries. And so that can make the other person shut down a little more. And then realizing as far as the sexual outcomes, right, that you may be getting couples that are at different places, right? Maybe they're coming in and they have a lot of arguments. Maybe people are in this area where one partner's dissatisfied and it's manageable despite differences, right? But they're really not over here. So there still might be work to do, right, in terms of fostering a connection or improvement. They may have just settled for manageable despite differences. Do you have anything?
Nope.
Any questions or thoughts?
It's a lot of content headed your way.
Okay, should we do our activity?
Well,
yeah.
Do we have time?
Yeah, I think we got time. Okay, well, yeah, we'll just go here. Okay, so we have a little case vignette, and what we'd like to do is we have 2 actors who have volunteered to be a couple, and we thought it might be helpful for us to kind of have some volunteers, and we're going to do what's called the tag team vignette, where we'll have a volunteer be the therapist, and then we'll have a couple, and so somebody can kind of start off like assessing for sexual communication, and then when somebody, like at about like a minute or 2 into it, then we'll have another person come and kind of do assessment, and we'll just kind of practice maybe using some of the things that you've learned today to kind of help this couple navigate their relationship. And so if I can get our actors to come up to the front. Okay, and do I have a volunteer therapist?
We'll have you guys.
Do I have a brave soul? Do you want actor names, or do you want to use your regular names? Okay, so Katie and Michael, you said? Micah, okay. Do you want to read the case vignette, or I can read it?
Yeah, let me read the case vignette. A couple in their 30s presents for therapy. The couple reports that they have communication problems. The couple has 3 children and just welcomed an additional child home. The child complains that they fight all the time. The wife complains that her husband does not help her enough with household chores. The husband complains that his wife never wants to have sex. The wife reports that she is too tired for sex after taking care of the children at home all day.
Okay.
So, yeah, so if we can get a therapist, and we'll mostly just focus on the sex stuff. If we recognize there's other communication concerns, but.
So we just want somebody to come and kind of like they're doing an intake and just kind of ask them a little bit more about their sex life, and we'll just kind of take turns and tag, and then we'll talk about it. Okay, great.
I'm a student therapist, so, no expectations.
We're all students.
All right, well, thanks for coming in today. I just kind of wanted to understand a little bit more about your sexual life. You reported in the intake about something that's been kind of hard lately. So I'd love to hear just from each of you kind of what's going on from your perspective, and we can start with you, if that's okay.
Well, he's always demanding to have sex, and I keep telling him that I'm too tired and I won't enjoy it, and I've tried to, participate in sex when I am tired, and it's not fun for me. So.
And of course, you'd start with her, it's all about her, right?
So you feel like everything's about her, especially with the sexual aspect?
Oh, absolutely. If she's tired, it's no. If she's too busy with the kids, it's no. If I'm not helping them, it's no. So, it's all about her.
Ever a time where she's like, yes, and you're like,
No.
no? What are some times where she is ready for
something? Maybe on a honeymoon she was.
Okay, so only at the very beginning of your relationship.
I mean, she said she tries when she's not tired. So.
But you kind of don't feel like she's really trying.
Maybe. Yeah.
So when you mentioned that the only time that you wanted to engage in sex was when you had the face, is that true? Or do you feel like
I feel like our first couple years of marriage were really fun and enjoyable. Sure, on our honeymoon we had sex, multiple times a day, and then of course it slowly tapered off from there to like once a week, and now it's like it used to be like once a month, and now it's like once every couple months, and so a part of me is like, we're not supposed to have sex every single day, and so like his happiest sexual time was like when he was having sex multiple times a day. I think that would hurt for a woman to do that every single day, right? Am I wrong?
that's good perspective that you have. What was enjoyable? So you said it used to be enjoyable. What about the sexual relationship?
It just felt very connecting, and it felt like, I don't know, orgasms are nice to have.
Is that something that you would like to have more often?
Yes, I would. I mean, even when we do have sex, lately it hasn't been happening, and so I also get frustrated afterwards, and so I'm like, what's the point?
So if you could experience orgasm more, you would want to engage in sex, or is that what?
Sometimes.
Okay. Have you heard Katie say this before?
No, this is new.
All right, let's time out for a second. Great job.
Yeah,
Let's
that was
give
great
a round
job.
of applause.
That was awesome.
All right, any questions that you guys think, where would, we're all therapists. Where would you be heading next? What would you want to ask about, or what would you be thinking about?
Well, it says that they welcome an additional child home. Like, that is huge. Is she breastfeeding? How long ago did she have the child? I mean, did she have a C-section, or was it a vaginal birth? Has she healed from either? If she, all those things are very, very important, especially after childbirth. I mean, is she lubricating at all when they do have had sex? Like, is she lubricating?
So functioning in the biological side is very, very important. Yeah.
I would want to know the ages of her other children, to know how much physical contact from her it takes to nurture them. And then also what kind of foreplay, if any, goes on. Like if arousal is part of what's making sex undesirable for her, or lack of arousal.
Well, and they're both complaining about needs not being met, right? She's so tired, he doesn't help with the kids or the dishes, and so she's totally spent, and he's not getting sex that he wants, and so maybe highlighting their problem in terms of that pattern a little bit, and that maybe if he was more willing to meet her needs, then she has more capacity to meet his needs, and then they both kind of, you know, the abundance mindset in that way. Well, I think I would go with helping both of them understand the difference between touch that is taking energy versus touch that gives energy. Because children sexual touch should be replenishing rather than draining. And so there needs to be something going on there with that.
Do you want to get another person?
Yeah. All right, let's get, yeah. I had a second thought with the husband, because, I mean, from the get-go, he was like, well, it's all about her. So what I was thinking is, to really try to reframe, because somehow I've noticed this with couples, like it begins as that this is fun for both of us, and we both are very sexual for, you know, if it's a healthy relationship. Then after kids, there is something that happens in how we're socialized, that the wife starts being like, well, he's just being a man, he just wants sex. That's all he wants, that's all he thinks about, and I'm just a sex object for him. It's no longer this, I'm also a sexual being. Because, I mean, I get it, I'm a mom, and it just encompasses, like, oh, so much of what we do that we forget. Like, there was a point in my life that I didn't think of him as, he just wants me sexually. Like, so to kind of reframe that in terms of, you know, for him wanting sex is really like, I want to connect with you, because right now, connection is not as strong as it used to be, because you're giving so much of yourself as you should to our children. So instead of like, you're just a sex animal, you just want me for my body, like, I want to be close to you. I mean, I think that's important for the wife to start thinking about it, and those sort of stuff. I'm just a sexual object. She just wants me for my body, and that's all there is to it.
Yeah. Yeah, no, that's a great point. Okay, let's get one more volunteer. I think we have time for one more volunteer.
Could you show us how you would do that with him?
Yeah, you wanna come up here? You just kept sucking. Okay.
So, like, just continue where we're
Sure.
at? Yeah, just continue. Okay.
So yeah, that's new information for me, that, you know, she wants to orgasm and wants to experience sex.
So, as soon as she said that, what came up for you? What did you feel about that? What did you think about that?
I think that'd be great. I'd be happy to have more sex.
That sounds okay. I can see your yes. Okay.
That's the whole goal here.
So let's talk a little bit more about what is sex to you, because I mean, sex is very different for everyone. Even though you can be having sex at the same time, but it's the meaning is different behind it. So for you, you're saying, I love sex, which is great. You should.
And
love
sex
to have
is love.
Sex with your sex is love.
And
Okay.
sex is a
Tell me more
celebration
about
of hard work I do.
what do you mean by that? Let's just
I'm at work all day, and I miss my family. I want to come home and be celebrated for the work I do.
So I'm a reward for you.
Sure, sex is the pinnacle of marriage.
So all I am is a reward to you.
Because I love you so much.
Okay, our reward. So you're saying, okay, I am all day at work, and you're working for the sake of your family. You want to be able to provide, which granted, I mean, I don't know about you, but I don't particularly understand the pressure of being a male, like, oh, the financial responsibility rests on my shoulders. I don't understand that 100%. So you're there and you are at home with the kids. How old is your youngest?
3 months.
That is rough. So you're probably very sleep deprived. Very sleep deprived. The first 3 months are survival mode for everyone involved. So you're tired, you're working all day, and you come home, and what is it that you really want? Because, I don't know, you don't sound as someone who, like, I just want to bang my wife. You don't look like that.
Oh, but he sounds like that when he gets home.
Oh, he sounds like that. So let's dig a little bit, okay? Because this is not working out for you. Sounding like that is not getting you what you want, which is having sex with your wife. You said it's the pinnacle of love. Sex is love. Love and reward are not the same thing.
True, I want connection. And that's what love is. I want that connection.
Could you tell her that? I
because it's different saying I want a connection than I want to connect with you.
I'm not with you all day. I know you with the kids, and it's hard. But ever since we've had kids, it's like I lost a piece of you.
See, he says things like this, and then he tries to shoot sex. So I feel like all he's trying to say there is whatever he thinks I want to hear so he can get in the bedroom.
Okay. And here's the thing. Do you want to connect with him?
I do.
Okay, so what ways do you want to connect with him? Because I understand as a woman, you can't just switch, you know? Does that make sense?
Yeah.
Probably, I mean, maybe I should ask you, do you need to feel connection before you can feel sexually aroused?
Yes, but feeling connected shouldn't always lead to sexual arousal.
Right. Okay, so what ways do you, maybe I should step back and say, do you feel connected to him?
That's been a long time since I've actually been.
In what ways do you don't remember from the last time you felt connected to him? What was he doing that helped you feel connected?
He took an interest in my day. He cared about not just like the things I just did, but he'd ask follow-up questions about things that I did. I really appreciate it when he takes Y and Z.
Okay, let's go ahead and stop there. Another round of applause. Thank you. That was great. Okay, so yeah, any other thoughts of like where you would have taken it or what you would have done? Yeah.
You can maybe reframe when she's like, I'm just a reward for you. You can maybe reframe that into like really what he's trying to say is, I want you, right? In all kinds of ways. And so maybe you could reframe that and help her see that differently and help him communicate that differently. Because her being a reward isn't necessarily a bad thing, right? She's like what he wants. That's a good thing. Right?
Yeah.
And so being able to like switch that from a negative to positive.
Yeah. Yeah, it's like he may say something and then it kind of means two things and she takes it the negative way. And you can just see how the couple continues to like accentuate the negative things that each other are saying when really you see a lot of desire, a lot of love between them, but they just can't overcome the obstacles, right? They had it in the beginning. She says, I mean, here, right, we see that functioning is happening, right? So it's not a functioning problem, it's a communication problem, and so helping them do that. I really liked when the therapist, and I don't know your name, sorry, but when you directed him to talk to her. And I think a lot of times when you're working with couples on this, sometimes it's good, but you kind of saw how when he talked directly to her, how does she respond? She didn't respond back to him. She responded to you as a therapist. And so sometimes I think when you're in therapy, it's really good to focus on getting the couple to talk together and helping them to communicate to each other. Because a lot of times what they do is like, that was very vulnerable. Like it felt like really powerful, like when he's just an actor, right? But like he's saying that.
I felt it, man.
I felt it. I don't know if y'all felt it. I felt it. But you know, when a partner like really says that to another partner, you feel that and you can see the other person like, she like closed up and was like, but this is the narrative that we've been saying. Like I gotta keep on the narrative. And it is scary because I think the fact is that couples are really scared that if I lower my guard, you're gonna abuse that, right? That's what she's afraid of. Like now you're gonna want sex all the time and you're gonna think you can have it, but I don't know that my needs are gonna be met, right? And so I think helping them to communicate directly to each other and not look so much to you, right? Helps them to be able to do that at home in the bedroom.
Yeah, great. Thanks for participating. That was fun. I want to, just for the sake of time, just because we're about done, I just want to ask, do you guys have any questions before we go, or any thoughts that that you, I don't know, wanted to get out there? All right, we're good. Okay, well, let's go ahead and end early then. We're about
we got 3
minutes
early.
Yeah. Don't say we never did anything nice.
Enjoy your free time.
Thanks, guys.
Thank you.